Now we have a keynote address by our esteemed member, Dr. Hemanti Vithlani. Dr. Hemanti Vithlani is a family practitioner since last 50 years in Malabar Hill, Mumbai. She was a scientific convener at annual conferences 3 times and an entertainment committee convener twice. She's always interested in GPA scientific activities and has been a conveyor at Jaslok Hospital Thursday CME for more than 10 years. Dr. Hemanti Vithlani.
Thank you for your kind words. And anyway, good afternoon, friends. At the outset, I thank our association for giving me this opportunity and doing this honor. Keynote address, the subject is the theme of this conference, a well-informed family physician for the good health of a nation. Keynote address is designed to present the issue of primary interest to an assembly and often to arouse unity and enthusiasm also. The theme is a broad one and an essential one too. The speakers yesterday and earlier today have been so good in addressing various specific issues from pharmacotherapy in family medicine to the complexities of criminal law and medicine. I propose to use my time, however, as this conference draws to a close, to speak in a more general way and a personal way. And anyway, this topic is so difficult, I found when I told Dr. Preeti, what am I going to talk? Anyway, something slowly has come up and I'm trying to read it out. See, the health of a nation first is defined as a state of complete physical, mental, and social health. They drew a triangle and like the 3 angles of that triangle. Social well-being and not merely the absence of disease or infirmity. So it's more on the positive side rather than the negative one. 2 main factors for these are life expectancy and mortality. These data are used as indicators of overall health of the population. Now, I'm starting with, in a general and my personal way. Our degree of MBBS was given to us after 4.5 years of medical practice, medical education, 1 year of internship in different branches. The training truly provides guidance to the fresh graduates to start their medical practice. But some real-life experience as a clinician is also needed. You can do 1 or 2 house posts in the hospital or can work in a family physician's clinic and learn the many tricks of the trade from them. I myself had worked for 6 months, 1 house post, and then worked with my own family doctor, late Dr. J.G. Unadkat. He has his 3 sons, all of them are doctors in different fields. He was my idol when I was studying medicine. He was a very successful and a good GP running 2 clinics. I learned the art of quick diagnosis, examination in a short time with a medical history also short, and come to quick examination of the patient and minimal or no investigations and give necessary treatment. I learned the art of dispensing like those cough mixtures. I mean, I have been practicing for 50 years now. So what we started and what things are today are different. So like I learned making those cough mixtures, giving those colorful tablets, giving injections, dressings, etc. from him. Around this time only, I met Dr. Jyotiben Parekh, and I did her locum. And I learned a lot from her with her modernization, like she was giving pediatric vaccinations, giving them the reminders, calls by post and all. And even gynec and antenatal part also she was doing. And I came in contact with Dr. Ramnik Parekh also. During this time, I came to know our GPA association and came to know with Dr. Gurvan Bhai Sheth, Dr. Dholakia, who are right now sitting in the audience here. I thank all of them and feel that it was so nice of them to mentor the new younger person like me. During this time, GPA activities like Thursday CMEs at Jaslok Hospital Center, GPs present their work and share interesting cases. Our annual medical conferences like this one have given me and given us a lot of insights and made me grow in my practice. Somebody okay? after all this learning, I was ready to have my own clinic, and my father-in-law and my husband supported me, and I started my own practice at Walkeshwar Road 50 years ago in 1974. With all these learnings, I started the basics, like a lot of things that I have picked up from all the senior GPs. Treating basic illnesses, pediatric immunizations, ear piercing for babies and adults, basic dressings, CLW repairs, post-surgery dressings, diet counselings, advice for thin and obese patients, antenatal and postnatal care and their guidance, premarital, marital counseling, advice for contraception, menopausal women counseling for their mental health, bone health, and do pap smears, etc., and cardiorespiratory illnesses also. Now see, basically I am born and brought up in Bombay, studied here, practicing also here in urban area only. Occasional visits to rural area has been very painful. I feel so sad when I see the medical facility stayed there. They have bare minimum things. I think they have to fight for their medicines also. But it is not enough. See, today our country is trying to do lots of things for the people in the interiors, but due to vast population, illiteracy, less number of trained doctors and nurses in the interior parts of the country, the status is still pitiful. The local bodies, organizations are now involved in medical health in villages like Gram Panchayat, Anganwadi staff, school teachers, etc., for their basic healthcare and hygiene. Oh, this is a list, but I'm just trying to read out. Leading health indicators, this is taken from CDC USA. Access to health services, clinical preventive services, environmental quality, maternal, infant and child health, senior citizens health, mental health. I want to say something about mental health here. Females in our society are burdened with work and taking care of children. They themselves are sometimes deprived of love and care. They are depressed. The female population in our country, many of them are depressed. They come to me, cry their heart out, and open up about their life. My listening ear helps them a lot. Some simple advice and care makes them feel good, and they feel relieved. In some cases, I do prescribe medicines if needed, but even the women population in our country needs a lot of help. Good health of a nation depends on many factors which are being tackled at national level. India, the longevity has gone up from 40 to 50 years of age to 70 years or more now. In the past, we had more infectious diseases and high mortality. Today, India has eradicated certain past illnesses, but has invited life cycle diseases like diabetes, hypertension, cancer. Vaccinations are going on large scale all over India. Free treatments are given to poor class and needy. Education is provided to mothers and family for encouraging healthy habits like healthy diet, good hygiene and sanitation, regular exercises, exposure to sunshine, rest, whole foods, relationships, even promotion of yoga and meditation. People are advised and motivated to avoid bad habits like smoking, chewing tobacco, drinking alcohol, etc.
Ma'am, 5 more minutes.
There are 4 basic tenets of medical ethics. Beneficence, work for the well-being of the patient to the best of your abilities. This is the primary ethical commitment of a doctor. Non-maleficence. The ancient Greek doctor Hippocrates is said to have said, first do no harm. Even today, doctors all over the world take this oath. Autonomy. A patient has the ultimate decision-making responsibility for his or her own treatment. A medical practitioner cannot force or impose treatment on a patient. A doctor has to maintain the confidentiality of the patient and about his or her illness and treatment. Justice. A doctor has to decide if advice and intervention is ethical or not, whether it is compatible with the law, patient's rights, and is fair and balanced. Access to medical care is important for the health of the nation. I think I'll cut short here. Now today the trend of the family practice is changing. The family practice is a dying breed now. The fresh graduates want to either go for post-graduation and super specialty. And there is a reversal trend among patients. They go to the consultants first and then come back with all the files and the papers to us to know what the consultant has advised and why. I think lots can be done by the younger generation of doctors if they wish to and they are properly motivated. Now here, I just remember some of the cases which I just feel like sharing with you. There was a male patient, 35. He found difficulty of climbing a slope to come to main road from his house. He was normal, he was doing these things since long. When he came to me, he was worried for some heart disease. And when I examined him, everything was normal. But when I got the reports done, his hemoglobin was only 5 grams. And it was found B12 deficiency, that is macrocytic anemia. He was treated, ECG, 2D echo, all other things were done which were normal. So I just a pallor which gave me an idea. He was just worried only for the heart condition. Another case I remember was a female of 40, epileptic. For a long time, she was on Gardinal and valproic acid. And she would fall down, so she was not allowed to go out the house or don't do anything in the kitchen near the gas stove. And she was really living miserable life. So somebody her friend or somebody brought her to me. And I told her, get the reports, whatever you have done so far. So when I saw the reports, the diagnosis written was temporal lobe epilepsy. And during that time only, we had heard Dr. Paresh Doshi in Jaslok Hospital, CMEs, that this can be corrected by surgery. So I just told her, and she said, no neurologist so far who have seen, she must have seen more than 10, 12, has suggested surgery. So I just said, no, you go and see Dr. Paresh Doshi, let's see what he says. The whole family was just surprised. The whole family came with his brother and her husband and her mother-in-law. And Dr. Paresh Doshi also said, yes, we can operate you and you should be fine. And ultimately she was operated. Then now she is on a very small dose of medicine only for the scar epilepsy. But she is living a normal life. She can go out alone. She can do cooking and all. Only thing, she is not still allowed driving by her husband because he is too worried. Then another patient I remember is a male patient who was accompanying her wife.
Ma'am, last 1 minute.
Finished. One minute, I'll finish. He complained of leg pains, calf pains. He was not the patient. He had come with his wife. And I just saw him and examined. And I said, I'm suspecting spinal canal stenosis, and you better do MRI spine. It was done. And he said, nobody has told me this so far in the last 3 months. But he was operated by Dr. Gautam Jhaveri. Again, this topic, spinal canal stenosis, also was taught to us in CME lectures by Dr. Gautam Jhaveri. So he is fine today. So I really feel, I think the CME of GPA has helped us a lot and to get good cases and diagnosis and the satisfaction of the treatment. And in the end, I would like to just say one, it's like a funny case. A female 35 or 40 came down from Delhi with a report serum creatinine in 6. And she was crying away. So I said, okay, I examined her, she was fine. So just show me the reports. So I took the reports in my hand. Patient name, some male patient and 75 years old. So I said, this is not your report, give me your reports. She said, she was flabbergasted because she came crying with the thing that her creatinine is 6. Another nephrologist had seen her yesterday, and everybody has just seen the reports. I just made an effort to see the name and the age. And I said, this is not your report. And she just hugged me and she was just crying away. So, sometimes some small things just helps you. So that patient still remembers that you just made my change in my life. And anyway, in the end, I would like to thank my patients for the trust in me, our General Practitioners Association. What I am today is all thanks to this association and its activities. My family and staff, my colleagues, my GPA friends, Dr. Meeta, Kumuda, Lalita, Ramila, Sunita, Preeti, Rajni, so many. And Dr. Vibhakar Advari, who has been accompanying us all the time from Malabari area to this area. So thank you. That's fine. So thank you all for your patient hearing. Thank you.
Thank you, ma'am.
Okay.
Now I call upon Dr. Bansode to felicitate Dr. Vithlani.